I've been doing a little work in our Concord Coalition Science Project here, looking at climate change. And of course, one of the potential effects there is impact on the healthcare system. And so when I was reading about the deficiencies that you described relative to preparing for the next pandemic, I'm also thinking we really need to do this to prepare for the changes that are coming to our climate that we can see coming down the road. And I don't mean to divert the conversation into something maybe none of us are an expert on, but I'm just saying there's another reason. There are other reasons out there to do this.
Bob, can I just interject here because I think this is a really important point. Think about this. One of the things with climate change that's going to have a big impact is going to be the changing locations and the population levels of a number of kinds of mosquitoes. Mosquitoes are the most fatal animal that is just out there in terms of human life. And we're going to see major shifts in locations where once we didn't expect to see dengue or malaria or some of these infections, and now we're going to because of climate change. It now provides an environment for these mosquitoes to actually do very well. You know what? We don't have a system for collecting that information at all and putting it into one central database to understand how do we deal with it? What do we tell the public? What do we do about it? How do we try to control these mosquito populations? And so I think your example of climate change is a really good one in terms of what the health implications can also be. So if we fix the system for one condition, we should be able to fix it almost at the same time for every condition. How do we share data safely, confidentially, but also in a manner that allows us to do the kind of extensive data analysis so we can provide answers to people about what's happening, why, and what can we do about it?
So on that note about data collection, one quick anecdote was, so I spent a couple of weeks overseas earlier this year in Israel, where they had a very robust testing system, and you got a PCR test, not a rapid test, but a PCR test when you got there, and you had to wait until you got the results until you were allowed to kind of mingle with society. But PCR test results came back within 4 to 5 hours. They didn't come back within a few days. And that I was thinking about because it was a lot less disruptive on things like work life, school life, things like that. Whereas here, if you were potentially a suspect case, you had to wait till your PCR test results got back in the beginning of the pandemic. That was like over a week, but it got better over time. But it's still, it could be a day or two still.
Yep.
And so I'm wondering, what can we do about that? Because that also relates to data collection and how quickly we can turn these things around.
Well, again, when the whole pandemic emerged, there was obviously a challenge getting testing up and going in this country. And when we say getting testing, there wasn't necessarily even specific to which kind of testing. Was it the PCR? Was it the lateral flow tests I just mentioned, et cetera? We never really had a national strategy for what we're going to do to test people. What would we do with the data? How would it be used? How timely was it would require it to be in order to be effective? And so I think what you're illustrating here is just that there are those rapid PCR tests, which are quite highly effective, that could have gotten information much sooner, that could have then tied people back to that information for them to take their own action on so that they didn't transmit to others. And I think, again, it's all about what I consider creative imagination. Imagine what a new system would look like if it did just what you just talked about. And it could. It's just we haven't done that. And now that the federal government is pulling out of supporting for testing, vaccines, drugs, providing respiratory protection, et cetera, I only see more backsliding that way in terms of helping us prepare for the next one. So your point's a really important one, and it's one that we're still not doing real well with.